found that to be true in my experience, but there's a good chance there are people who are abusing substances that I don't know about. And I guess it depends on the level of substance abuse. Are you talking tobacco? Yes, because they have a doorway, easy access to the outside, so they can go and smoke. If you mean alcohol, it's not accessible in the department. You can't drink while you're working, but I can tell you that there are many times after really bad shifts when nurses bond together that they, even on night shift, there's a restaurant in town that will serve alcohol at breakfast, and emergency nurses would go out for breakfast and drink alcohol with their breakfast. So yes, there is the chance for there to be a pattern developing with alcohol use as a stress reduction agent after extremely stressful cases, you might say, in the emergency department. As far as narcotic use and diversion of drugs, in my emergency nursing career, which I've done critical care, ER, and flight nursing, and I spent 20 years in the ER flight environment, there's only been one nurse that I know for sure diverted drugs and used them, and another nurse that there was a high suspicion for, which is a pretty small number when you have a staff of nurses and techs that's at least currently 130 working in a large academic medical center department. So we don't see that, but illicit drug use is across all socioeconomic groups, from high-level executives to people who are in the middle income range to people who are living almost in poverty. So that's a situation where you may not even be able to identify or be aware of someone actually using substances. And then you can talk about other things like caffeine, which is something that is in coffee, and you don't want to interfere with the coffee being brewed and there being coffee available for staff. I remember one time when they made a decision that there would be no coffee provided for staff. Staff had to provide all of their own, and that created an uproar in the department. And then soda. If you look across the break room and look at the beverages that are being consumed, you'll see a high number of coffee mugs and a high number of Mountain Dew drinks, which are very high in caffeine.